Welcome to the Tech Connect podcast powered by PDi. This will be an ongoing series of informative information regarding technology and improvements in our industry. We'll be airing sessions the first Thursday of every month. Welcome back to PDi's Tech Connect podcast. I'm Glen, Rocco, and I'm here with Kat Sattel, the marketing manager at PDi. And today we'd like to talk about reducing readmissions. Welcome, Kat. How are you today?
Good. Doing great. Thanks for having me, Glen.
You're welcome. So industry drivers are leaning more towards CMS-based backed readmissions information from the old fee for service. Yeah. Mm-hmm. And today I'd like to talk about and understand the hospital readmissions reduction program and tell us more about what that is.
Great. Yeah. So as the marketing manager at PDi, I like to understand, what's happening in the industry drivers, and issues of concern for our customers. That topic, readmissions, is a major concern in the healthcare industry. It impacts not only the quality of care, but also the financial health of the organization. Sure. And it makes sense, right? For valid reasons, patients might be hesitant to visit a hospital with a high readmission rate. So let's break this program down. The 2010 Affordable Care Act, ACA, actually established the Hospital Readmission Reduction Program, the HRRP. It's a value-based purchasing program. Specifically, what this payment reform program allows is for CMS, Centers for Medicare and Medicaid Services, to reduce payments to the HRRP eligible hospitals that have excess or higher than national average readmission rates, 30-day readmission rates for certain conditions or procedures. The goal was to reduce readmissions by improving patient engagement, communication, discharge planning, care coordination, so that patients basically stick to their care plan once they're discharged from the hospital. But we know disengagement and non-compliance are the top causes of what are actually preventable readmissions. Patients who don't understand the importance of their treatments or don't take it seriously might ignore their discharge instructions. And for over a decade now, organizations in healthcare are working to overcome this. Today, however, nearly 2,500 hospital reimbursement payments from CMS will be reduced or impacted this year. Medicare will cut payments by the maximum 3% cut in fiscal year 2023 at 17 hospitals across the country. That 3% payment will take a hit on Medicare patient stays during the period of October 1st, 2022 through September 30th, 2023, the fiscal year. And that is an improvement, though, however. Last fiscal year, 39 hospitals faced that maximum penalty.
You mentioned select conditions being impacted in the readmission measures. Can you tell me which ones are impacted?
Yeah, sure. When the program initially started, it covered heart attacks, heart failure, and pneumonia. However, this fiscal year 23, pneumonia has been dropped as a measure. It's been suppressed due to COVID because they're not including quarter 1 and 2 data from the 2020 evaluation period. So heart attacks, heart failure, and pneumonia initially. In 2015, they added COPD and elective total hip or knee replacement surgery. And then in 2017, heart bypass surgery was added as a measure.
You also mentioned that national averages. What can people do to figure out what the national averages are, or can you lead us down that path a little?
Yeah, sure. So I have some data on that. The lowest rate was for elective total hip and knee replacement, but it was still a 4% readmit rate. The highest readmit was for heart failure at over 21%, and then heart attacks were 14.6%. Heart bypass 11.8%, and COPD readmission rate national average was 19.7%.
So impact to hospitals. How many hospitals typically are getting penalized, and does that money going to taxpayers? Is it saving in taxes? Where's the benefit?
Sure, yeah. So let me clarify. These are general acute care hospitals. So the program excludes about 2,000 hospitals that are exempt. That includes facilities that specialize in care for children, for psychiatric patients, or for our veterans. Also, rehabilitation, and long-term care hospitals are also excluded, as are your critical access hospitals, since they're basically the only game in town. So over the lifetime of the program, 2,900 hospitals have been penalized at least once, and that's 93% of the eligible population of hospitals. Over 1,200 hospitals have been punished all of the past 10 years. It's in its 10th round right now, and Medicare is reducing payments yet to 2,499 general acute care hospitals, or 47% of the eligible facilities. Now, while that number is smaller than it was in prior years, it is important to note that's still an awful lot of patients returning within 30 days, and that's an awful lot of hospitals getting hit with that readmission penalty, which averages at an average penalty reduction is about 0.64%.
So we love our nurses. They're very vital to everyone's care. What can they do to help prevent these readmissions?
Yeah, sure. So while some readmissions might be necessary, many are not. And some say if there is such a thing as low-hanging fruit, this is the low-hanging fruit. So nurses can target patients at the highest risk for readmissions. Heart failure patients are one of the highest ones. The very elderly who might have a difficulty in understanding the discharge instructions or remembering their follow-up care instructions, or patients with complex other medical complexities or social needs. There's also those who they don't have the financial resources or the proper support teams for best follow-up care post-discharge. So the hospital staff could help those people out with, suggesting free clinics, or perhaps prescription drug assistance programs that are available. They can also help focus on preventative measures, right? Prevention's always better than treatments, and things like education or other resources the patients might need, like dietary restrictions, dietitians, and training or personal training habits, things like that. So another area is focusing on clinical excellence and investing in quality improvement strategies or processes for workforce innovations. That's another method to help with the reduction in readmissions rates. So nurses and their teams can help standardize clinical workflows by maybe leveraging electronic tools or digital tools to better assist where needed. Now, certainly we know technology is not going to replace the nurses, but we believe when used properly, it can support patients and their caregivers with their information needs. So for instance, maybe begin the discharge planning process earlier on. So with our Genio smart TVs that PDi produces, a facility can link to something for the patient's medication information so that they can raise awareness on managing medication interactions with other drugs, or they can show the proper scheduling of when to take your medications. Genio could also link to specific patient education video content where patients and caregivers can re-watch the videos and embed it in their minds so that they can remember it. This ensures that they understand what their post-discharge care instructions are, and the nurses will be able to come back in and quiz the patients and test them on their level of understanding. Maybe even there's videos to provide additional training resources for what to watch out for. Based on the procedure or the condition that was treated, there's probably common pitfalls that they can train them and avoid them. And so if they have specialized video training content that they can share, that's very easy to do on our smart TVs as well. So, it's all about patient comprehension and communication, and having that communication earlier on, having that dialogue, I think, earlier on in the process, rather than the time of discharge when the patients and their family caregivers are excited to just get out the door. I think that leveraging those tools at the patient bedside, can certainly help improve their level of understanding. So tools like the Genio software enhances the communications and helps the healthcare team understand where the pitfalls are, where their misunderstandings are, and what they need educated on prior to, getting them out the door.
Kat, that was some wonderful information. Thank you very much. I appreciate how you can tie Genio into assisting with the reduction in readmissions. Please, audience, let us know if we can help you with a demo to give you more personalized viewpoint of how these services can be implemented and adopted in your facility.
So Glenn, it is also estimated that roughly 2 million patients are readmitted each year, costing Medicare $26 billion. That's a lot of taxpayer dollars. CMS estimates the preventable readmission rate is 65% of that, or $17 billion. Can be avoided. So CMS also estimates that this program for hospital readmission reduction will save $521 million in fiscal year 2022.
Wonderful.
So I just want to say that as a U.S. manufacturer of complete patient entertainment and information solutions, I'm really proud of what the team at PDi does to understand and improve the patient experience and the caregiver experience and the healthcare provider experience. Payment reform like CMS's hospital readmissions reduction program is one of the tools that helps hospital staff do the right thing. And that's a core value here at PDi also, to do what is right. We have teams to support hospitals and healthcare clinics with patient engagement TV solutions, the software, the installation, the implementation, to customize it for the experience that they need to help them with their specific initiatives. And I know you do Genio webinars all the time, daily with customers. So there isn't probably much that you haven't already solved for, that PDi hasn't already seen and solved for already. So all I can say is let's continue the conversation.
Wonderful. Thank you very much. Thank you for joining us today on this episode of Tech Connect, and please check back in with us.